Thank you, everyone. It's been an amazing day, and I am so honored to be able to share this vision and this passion with you all. It's just amazing. So, what is your world lens? The lens from which you view our world, the issues that's been spoken about today, but most importantly, the solutions to those issues. How do you view our world? Is it inclusive enough of what defines us as human? Or is it a danger, a nuisance to our essence as human beings? I sound posh, right? I'm sure I do. But these philosophical-like questions were nowhere near my mind when I fell in love the first time. It was tall, fluffy, kinky afro hair. It has this dark eyes that was as dark as the starless Arabian night. I remember that vividly well. But those eyes were dark contrast to his white doctor coat. And I was like this. But what mattered that day was that, I missed a step there. If I had been attached to a cardiac monitor that day, I'm sure by now my name will be on the Guinness Book of Record as the fastest pulse rate girl in the world. This guy bent over and he leaned onto me and he said, "And how are you doing yourself, young lady?" And a gasp escaped me. I'm not sure if the gasp was from my tired lung from my pneumonic condition or if it was a tug from my heart. But what I knew that moment was he saw me and he asked me. I was no longer fading away with the other voices in the room, like Sasha said, that kept talking and talking without talking with me. He saw me beyond my pneumonia, and he felt he had to ask me. I fell in love that day, and I was only 4.5 years old. It would take me at least 2 decades to really understand the impact of what happened that day. For me to understand that what I thought was love was actually an act of humanity. He saw me. I mattered. There was something about that I realized. Humanity, our traits, our values, the things that made us actually humans was what mattered. Some people call it compassion, you can call it emotion, you can call it altruism, you can name it whatever you want to name it, but it's that one single heart that mattered. I met Zainab when I was working as an emergency nurse in a rural community, not a rural community, actually it's a city now, in Lagos, Nigeria. Zainab was 6 years old. And I remember that every single Friday while I'm on shift, the mom would rush Zainab into my emergency department. And I remember we all actually have this joke in the hospital then that make sure the oxygen is ready, make sure the IV line is ready, make sure the nebulizer is ready, because 11:45 p.m., Zainab is coming in. It was a joke. And lo and behold, on this fateful day, it didn't cease. Zainab was rushed in by a frantic mom, again with an episode of acute asthma attack. And we did the same thing we do all the time. Put her on an inhaler, nebulizer, set the line, leave them alone, have them do what they have to do. But on this one occasion, I have no idea what happened, but I remember vividly well as I knelt down to Zainab's level. And I said, "Zainab, are you ready to go home now?" And she looked at me. For the first time in the 6 months that I had been Zainab's nurse, Zainab looked at me. And there was a sparkle that I remembered as a tug of my heart with Dr. Gideon when I was 4.5 years old. And she pulled my uniform and she shook her head. That was the first ever reaction I've ever had from Zainab. And that night we kept her in that emergency department. and we formed a connection, a friendship. It was from that friendship that I learned that in Zainab's house on every Friday night, something we've joked about for 6 months, the mom cooked with kerosene fuel in the kitchen. Nothing different, but on this Friday night is when the dad decides to invite all his 20 friends over, so the woman would have to cook more. So that means Zainab gets more exposed to kerosene fuel, which exacerbates her asthmatic attack. The reason why she comes in every single Friday. No brainer. But that single act of kneeling down to Zainab's lens and asking her, are you ready to go home? Started us, changed 3 things in the course of my life and in that hospital. 1, health promotion. We started talking to Zainab's mom about the danger of cooking with kerosene fuel. We started telling her, yes, you might not be able to afford something better, but Zainab is asthmatic, so maybe Zainab should not be in the kitchen. 2, we changed the way we collected data from our patients. Every single doctor, every single nurse knew that when you get a patient, you ask them every single question that needs to be asked. What are you cooking with? Who smokes in your house? What have you eaten? Like Nif was saying, have you had dinner? You're checking blood sugar, have they eaten? I don't know. It changed the course of how we gathered data in our emergency departments. It improved the health of the people we cared for. One act of humanity changed the health of multiple people that further walked in through that emergency department. Then 3rd, it took me away from nursing. I don't know. Because I realized during those events that I need to do more. I love nursing, I'm passionate about it, and I will always be thankful for nursing for who I am. But I needed to do more. So it took me on this journey to do a master's in public health. I just studied nothing no-brainer. I looked at anemia in women and children from cooking fuel. But beyond that, I am now currently doing a PhD in global health where I am looking and actively advocating for the voices of the people that we work with to be included in the things that we do. Because that was what mattered to me, that was what mattered to Zainab. And this is taking me on a journey to Malawi, a rural community that lives on less than $1 a day. And this story that I'm going to tell you very quickly is about a pregnant woman that I met in that community. She was pregnant, and when I met her, she was as flat can be. We've talked about mental health today. As a researcher, a young researcher, I wanted to measure the smoke in her kitchen. But there was something about it that stopped me. She was flat, the kitchen walls were half broken down, and I was like, I could easily hang up my monitor and then move on and collect my data. But then I know that if I go back 24 hours later, there is a risk that this woman will no longer be there. Or if she is, those pregnancy might not be a positive outcome. So I stopped. You said we should stop. So I stopped. And for the price of €3.50, the price of my cappuccino in Cork City, we fixed the wall for this woman. It didn't disturb my data. It did not. It's one household in 200 households. That act of humanity, 48 hours later, the flat girl that was sitting down on a chair looking at me like, oh, here they come again, she ran out from her household and gave me a hug on the street. If you ask me the most impactful impact of my PhD, it is that one incident, where the mental health of a pregnant woman was changed by €3.50 just because I stopped. What is the value of your humanity? From which lens do you look at the people that you deal with? How do you define your value of benevolence? What is the height of your kindness? What is the depth of the care that you give to people? What is it about you that people see and they want to be a better person? Are you a politician and you sit down at a round table and you make decisions about our health and the health of our planet? If you were living in Gaza, would you make the same decision? If you have family members there, would that decision be the same? If you're a researcher and you go into a household and you know one thing you're going to do that day is going to change that person's life, but because you think you would tend to date her and you did not do that one thing, if that was your daughter, your sister, your household, would you make the same decision? Because if you can't, then you need to stop. You need to think before you act. Humanity is what makes us us. Without it, we are no longer different from this wall or all these SDGs that we pasted around the wall. Behind every one of those 17 SDGs are people. And behind the essence of those people is the way we see them, the way we treat them, the way we act around them, the way we care for them. Because if you don't, we would lose the essence of who we are as humans. If you cease to see the world from the lens of humanity, if you cease because you're afraid that if you touch somebody, you might get HIV. Oh, well, excuse me. If you do not give a smile for those that do not have a smile. I saw this thing one day. It says, if somebody doesn't have a smile, give them yours. Absolutely, give them yours. It saves you wrinkles. Oh, excuse me. It's so simple. It is the most simplest act that we can ever do. The connection between humanity and health, we can no longer afford not to see it. If you do not care, all this money we are pumping into the SDG, the 70 SDGs, we could as well just dig a hole and put them in there. So I challenge you today, as you leave this auditorium, to love, to care, to be kind, to be patient, to see people, to ask people, to share the things that makes you you, to hold and embrace what makes us human. Thank you all.